Something changed at the Social Security Administration this year, and a lot of people have been asking what it actually means for them. If you receive SSI, SSDI, or regular Social Security retirement and benefits, this video breaks it down in plain, simple terms. The Social Security Administration, commonly known as the SSA, has been going through some notable adjustments in 2026. Some of these changes have been in the works for a while, others reflect updated federal guidelines, and for millions of Americans who depend on Social Security in some form, understanding what may or may not apply to their situation is genuinely useful. Now, there has been quite a bit of discussion online about these updates, and some of it has been confusing or incomplete. So the goal of this video is straightforward. We are going to walk through what has actually been reported about these changes, explain what each program is, and help you understand the general landscape without overstating anything or creating unnecessary concern. This covers three main programs: SSI, which is Supplemental Security Income, SSDI, which is Social Security Disability Insurance, and the standard Social Security Retirement Benefit that most people become eligible for in their 60s. Each one works a little differently, and the changes affecting each program can vary depending on your specific situation. Let us start with some background because it helps to understand what these programs are before discussing what may have shifted. Social Security retirement benefits are what most people think of when they hear the phrase Social Security. This is the program funded through payroll taxes over your working years. Once you reach eligibility age, which is currently 62 for early benefits and 67 for full retirement age, for most people born after 1960, you can begin receiving monthly payments. The amount you receive is based on your lifetime earnings history. SSDI, or Social Security Disability Insurance, is a separate program for people who have worked and paid into the Social Security system but have developed a medical condition that prevents them from working. It is not a welfare program, it is an earned benefit similar in structure to retirement benefits but triggered by disability rather than age. SSI, or Supplemental Security Income, is different from both of those. It is a needs-based program designed to help people with very limited income and resources, including elderly individuals, people who are blind, or people with disabilities regardless of their work history. SSI is funded through general tax revenues, not the Social Security Trust Fund. Now, what has changed in 2026? One of the more significant updates that has been discussed involves the SSA's approach to certain resource limits and income counting rules, particularly as they relate to SSI recipients. For many years, SSI had resource limits that had not been adjusted in decades. There have been ongoing policy conversations in Washington about whether those limits still reflect the economic realities of everyday Americans. Based on current reporting, some adjustments to how certain resources are evaluated may be taking effect or phasing in during this period. This can vary depending on how and when specific rule changes are implemented at the federal level. Another area that has come up in discussion is the cost of living adjustment, or COLA, which the SSA applies annually. For 2026, a COLA was applied to Social Security retirement, SSDI, and SSI payments at the start of the year, as is typical. This annual adjustment is tied to inflation data and is meant to help beneficiaries maintain purchasing power over time. The actual percentage varies from year to year based on economic conditions. There has also been discussion around the SSA's operational changes. The agency has been working through staffing and service delivery adjustments, and some of those changes may affect how people interact with their local Social Security offices, how processing times work for new applications, and how certain reviews and redeterminations are handled. For people currently receiving benefits, it is worth being aware that these administrative changes may affect response times or processes, though the underlying eligibility rules for most recipients remain based on the same federal criteria. For SSDI recipients specifically, one area that sometimes creates questions is the Substantial Gainful Activity Threshold, often abbreviated as SGA. This is the earnings level that the SSA uses to determine whether someone receiving disability benefits is engaging in work activity that might affect their eligibility. The SSA typically adjusts this threshold annually. In 2026, the updated figures reflect that ongoing annual adjustment. If you are a disability benefit recipient and you are working in some capacity or thinking about returning to work, it is worth understanding how the current SGA threshold applies to your specific situation, and the SSA website or a benefits counselor can provide the most accurate guidance. For seniors on Social Security retirement benefits, the major touchpoint at the start of any year is typically the COLA adjustment and any changes to Medicare premium deductions. Since Medicare Part B premiums are often deducted, directly from Social Security checks. Changes in those premiums can affect the net amount that arrives in a beneficiary's account each month, even when the gross benefit has increased. This is something that many recipients notice and occasionally find confusing, so it is worth understanding that the two programs interact in that way. There is also ongoing attention being paid to Social Security's long-term financial outlook and the broader policy conversations happening in Congress about program sustainability. While those conversations are part of the public record, it is important to note that no confirmed changes to benefit structures for current or near-retirement recipients have been enacted at the time this video was produced. Policy discussions and legislative proposals are different from enacted changes, and this video is focused on what has actually been reported as taking effect, not on speculation about what might happen in the future. If you want clear and simple explanations like this, you can subscribe to Law Brief USA. Now, a few things worth keeping in mind as you process all of this. First, the Social Security system is large and complex, and how any particular update applies to you personally can depend on a number of individual factors. Your benefit type, your income, your household situation, your age, and your work history all play a role in determining what rules govern your case. So while we can explain what has generally been reported, this video is not a substitute for checking your own account or speaking with the SSA directly. Second, the SSA itself is the most reliable source for information about your specific benefits. You can access your personal Social Security account at ssa.gov, where you can review your earnings record, see your estimated benefit amounts, and find information about any notices or updates related to your account. If you have received a letter from the SSA about a change to your benefits, that letter is the authoritative source for your situation. Third, policies at the federal level can and do evolve. What is accurate at the time of this video may be subject to further updates, regulatory clarifications, or legislative changes down the road. Staying informed through official sources is always a reasonable practice. Fourth, for people who feel they need more detailed guidance, there are resources available. Benefits counselors, legal aid organizations that specialize in Social Security issues, and the SSA's own representatives can all be helpful depending on the complexity of your situation. There is no requirement to navigate this alone, and many of these resources are either free or low cost. So, what is the general takeaway here for everyday Americans thinking about their Social Security situation in 2026? For retirement benefit recipients, the beginning of the year is a natural time to review your benefit statement, understand how the COLA adjustment has affected your monthly payment, and take note of any changes in Medicare deductions if applicable. This does not require any urgent action. It is simply a matter of staying informed about your own financial picture. For SSDI recipients, understanding the current to substantial gainful activity threshold is useful background knowledge, particularly if your circumstances have changed or if you are exploring work options. The SSA has programs specifically designed to support people who want to test their ability to return to work without immediately losing their benefits, and learning about those programs at a general level can be worthwhile. For SSI recipients, the ongoing policy conversations around resource limits and income counting rules are worth following, particularly if you are near current threshold levels. Any confirmed changes that take effect would generally be communicated through official SSA channels, so checking ssa.gov periodically or signing up for SSA notifications can be a helpful habit. For people who are approaching eligibility age and thinking about when to claim Social Security retirement benefits, the general framework has not changed. The decision of when to claim is a personal one that depends on health, financial circumstances, and other individual factors. Information about how benefit amounts differ based on claiming age is available through the SSA, and many financial advisors or benefits counselors can help walk through the options. For family members helping an elderly parent or a loved one with disabilities navigate their benefits, being generally informed about how these programs work is valuable. Understanding the difference between SSI and SSDI, knowing what the SSA's review process looks like, and knowing where to find official information are all reasonable things to have as background knowledge. One thing worth noting is that the SSA does communicate with beneficiaries directly when something changes that affects their specific case. If a change is significant enough to affect your payment or your eligibility, the SSA typically sends written notice. So if you have not received any such communication, that generally means your individual situation has not been flagged for a change based on their records. Social Security is one of the most important programs in the United States, touching the lives of millions of seniors, people with disabilities, and families across the country. Changes to how it operates, how benefits are calculated, and how the agency functions are topics that many people reasonably want to understand. Our goal with this video was simply to offer a clear, grounded explanation of what has been reported about the 2026 updates without overstating anything or creating unnecessary concern. These are real programs with real rules, and understanding them in general terms is always a reasonable thing to do. That is what we focus on here at Law Brief USA.